Let's jump right in because there's so much to discuss today. I believe it was 2 weeks ago, we did a live stream covering this horrible mass shooting that took place in San Jose. And I was saying, and many people in the audience were saying, as we were watching the press conferences and the calls for thoughts and prayers and support of the families and all of this stuff, are we ever going to do anything? Are we even going to get a proposal to do something that might actually do something about what's going on? And the biggest problem, arguably, in the United States is gun culture. And it's the idea of seeing firearms as something to bolster masculinity, something to make political points, something to solve interpersonal problems. And of course, if we resolved that, there would be way fewer other problems to figure out. Now, that's not the case. The situation is far more complicated than that. And so as a result, we need to do other things. I'm really glad to say, even though who the hell knows if this has any shot of becoming a reality, about 2 weeks after that incident in which the gunman shot 9 coworkers at the San Jose light rail yard, CNN is reporting that the mayor of San Jose is proposing something that I've talked about before, other gun safety advocates have talked about before, but has not really been taken very seriously anywhere, which is a restriction that would require gun owners in the city of San Jose to obtain insurance for their firearm. If they are a firearm owner, you must get insurance, sort of like you do with a vehicle. The vehicle, although it's primarily for transportation, you can do really irresponsible and dangerous things with a vehicle. Things can also happen to the vehicle. And so in most states, you're required to have insurance on the vehicle. Much the same way you could require gun owners to have insurance because they are gun owners, as well as the proposal is to pay an annual fee to cover the cost of gun violence. And this is one of those things that most of the discussion is about, let's ban this type of gun, let's ban that type of gun. That's something that we should be looking into. Universal background checks, absolutely. But treating firearms the way we treat vehicles, which includes licensing requirements and relicensing requirements, as well as mandatory insurance in most states, is actually a really good idea. Now, the mayor of San Jose is Sam Liccardo, I'm not sure how it's pronounced. He unveiled this earlier this week, and he said, quote, "If we cannot stop the horrors of gun violence in our cities," and this is important because just requiring insurance won't actually stop gun violence. But he says, if we cannot stop the horrors of gun violence in our cities, at least we're going to have the public stop paying for it. The Second Amendment protects the right of Americans to own guns, but does not require that every other taxpayer pay for that right. Requiring gun users to pay fees will help fund critical emergency medical and police response and reduce our taxpayers' burden. The way the proposal would work, according to CNN, is all gun and ammunition purchases would have to be recorded on video and audio to discourage straw purchases, where people who are legally ineligible to buy guns figure out a way to get a gun through a straw purchaser. The straw purchasers would be far less willing to do that if they knew that every transaction that was legal, at some point it's a legal gun, that they would be less likely to do that. Additionally, suicide prevention materials would be required at point of sale. This is taking seriously something that many gun rights advocates point out, which is, hey, a lot of these deaths are suicide. Okay, yeah. So we basically have 3 categories of problems with gun violence. We have suicides. There's no reason not to admit that that's an issue. That is dealt with very differently than individual handgun homicides. You will often hear the right say, all this focus on AR-15s, most of the deaths are coming from handguns. Well, we need an approach for handguns. And then you have the mass shootings. These are 3 different problems, all under the umbrella of gun violence and gun death, and we need different approaches for each of them. Liccardo's proposal also includes leveraging federal information for early intervention. This is something that's relevant because we often will hear, and in the case of San Jose, it was the case, that the gunman had a previous interaction with law enforcement. He had been detained by Customs and Border Protection officers who discovered books on terrorism and writings that were filled with hatred towards his workplace. He ended up shooting up his workplace. San Jose police were never notified. and had no idea that this is someone that should have been on their radar. There's a lot of good meat to this proposal. Now, the gun rights people, of course, are going to be against it. However, not all of them are against it. And I've said this before, it's not just Republicans who own the guns. Yes, it's probably more than 50%. But I know many people on the left who also own guns, and every single one of them, particularly in blue states, is fine with all of this stuff because they realize that it makes sense for there to be some hurdles to clear to obtain firearms. If you think driving comes with significant responsibility, and licensing makes sense, and insurance makes sense, and relicensing and registration fees and all of these different filters make sense, as my liberal friends tend to believe, then it follows that the same would be a requirement of something like firearms. You're not restricting the Second Amendment by putting these restrictions in place. You are not limiting one's ability to obtain a firearm as long as they are willing to go through these processes. So I have no idea if this will go anywhere in San Jose. I have no idea if there would be problems from higher courts on legal challenge. This is just step one. But I've been talking about mandatory gun insurance for years at this point on this program, and I'm really happy to see that this is actually being proposed. Let me know what else you think. Oh, and let me mention, speaking of what else, changing culture around using firearms in the United States. There are examples of countries with lots of firearms that don't have our problems, and the difference is the people. We have a problem with the people in this country seeing firearms as a way to solve problems. And listen, universal healthcare. There's no doubt that if you really want to take seriously, if you're a gun rights activist and you want to take, even if you're cynical in your desire to take attention off of mass shootings and homicides by putting the focus on suicides, if you want to be serious about that, then support universal healthcare of some kind, whether it's Medicare for all, whether it's some kind of provision for mental health care that is always available regardless of insurance status. Because if you really want to deal with suicides and, by the way, mass shootings and individual handgun homicides, how are we not giving people full access to mental health care? So if you want to really put your money where your mouth is as someone who claims to, if you're on the right, and say the real problem is suicides, what is your plan for getting health care to everybody so that everybody has access to a therapist and to whatever it is that they need along that front? But my question to you is, let me know what else you believe is the lowest hanging fruit as far as firearms are concerned. During the pandemic, and even at this point, I try to avoid physically visiting a doctor's office unless I really have to. And that's why I love our sponsor, SteadyMD Primary Care. You take a quiz, you get matched with a licensed primary care physician who's a good fit for you. You have a 1-hour virtual appointment and you start a meaningful relationship with your new doctor. After that, your doctor is available to you anytime by text, phone, and video chat. And unlike other services, this isn't some random doctor on call. Each doctor at SteadyMD has a limited number of patients so they can give you the personal attention you deserve. They can help you with anything your primary care doctor normally would: healthy diet, managing conditions, weight loss, sleep, depression, anxiety. You don't need insurance. It's just $99 a month with absolutely no other fees or copays for visits. Take the free quiz and see which doctor is a perfect fit for you. Go to steadymd.com/Pakman. There's no risk, no long-term commitment. The link is right underneath this video.